we can all do a better physical exam, even like looking in people's mouths. But you guys probably do it all the time with ID. But I'm like, is it thrush? I guess nystatin won't hurt.
Well, if you can scrape it off with a tongue depressor, right? Comes off. Typically, Candida and thrush, they'll leave like an erythematous base because it's invasive.
Mhm.
It's an invasive species. So
Whereas like if it's like just mouth buildup,
exactly, it's
then it
really
wouldn't need that erythematous base.
sometimes it doesn't even
It would,
scrape off. You know,
ocean's great. Yeah,
Candida is like it's creamy, like it just you squeegee it right off. And you see this red
uh,
little base to it.
that's
Um,
good. I appreciate that pro tip.
and I will say, sometimes it's confusing. Sometimes it really is. You're like, is it the beginning of thrush? I mean, you can get a lot of interesting, growth on the
On the
edges
tongue.
of tongues, on the surface of the tongues, on the cheeks that are certainly not candida. But again, if you have a patient who's seeing a lot of antibiotics, potentially seeing steroids, something immune suppressant,
Yeah.
and they're at risk for candida
Gosh.
overgrowth, and these lesions come off and they're painful, or they have a red base to them, okay, you're building a really good case for thrush. Uh,
That's great.
and it can come in different versions. And I think if there's any confusion, I'd say it's okay to start the nystatin. Of course, being stewards of antifungal agents, we don't
Mm.
want to breed resistance or expose
That's
these
true.
agents to
I shouldn't have been
pathogens.
too lax about it.
Don't be too lax about it.